it. Today I'll be presenting a review of the efficacy of extended antibiotic prophylaxis in patients with a BMI over 30 undergoing total hip or total knee arthroplasty that I prepared under the mentorship of Tejbir Pannu. He's a PGY1 at Larkin Community Hospital. And so just as a brief overview, the incidence of postoperative infection in the United States is 5.4% for patients undergoing total hip and 4.8% for patients undergoing total knee arthroplasty, respectively. The risk of postoperative infection increases by 6.7 times in operations on patients with severe obesity, those with a BMI greater than 35. And these infections not only increase morbidity and mortality, but also increase the average hospital stay and lead to recurrence of surgery. Infection rates are statistically significantly higher in a patient population with a BMI over 35. Postoperative infection can be prevented by the use of antibiotics, and the use of extended use prophylaxis. Antibiotics have been proposed in the high-risk populations undergoing TKA and THA in order to mitigate the infection rates. The standard regimen for extended use of prophylactic antibiotics is a minimum of 7 days after discharge, and 7 days if you're using a cephalosporin. Recent studies have explored the impacts that extended use of prophylactic antibiotics have on reducing the rates of postoperative infection in patient populations with a higher BMI. The goal of this review was to evaluate the efficacy of extended prophylactic antibiotics following total hip arthroplasty and total knee arthroplasty in patients with a BMI over 35 in order to reduce the rates and incidence of postoperative infection, since the rates of infection are higher in that patient population. A systematic search was implemented and identified studies regarding the use of an extended prophylaxis and antibiotic regimen among TKA and THA patients with a BMI over 35. All data was obtained using published peer-reviewed articles from PubMed and Google Scholar, utilizing specific keywords. The data was not limited to a particular time frame. As a result, there was a noted 81% reduction in PGI in patients undergoing TKA and THA in a BMI over 35 when treated with prophylaxis. Evidence of an incidence of infection reduction of 3.9 was statistically significant in a patient with BMI over 40 treated with extended antibiotic prophylaxis. In conclusion, the data shows that extended antibiotic prophylaxis prevents postoperative infection rates in high-risk patients, including those with a BMI over 35 undergoing total hip or total knee procedures. More research is needed to be done to standardize the methods of prophylaxis, as there is not one standardized gold standard, but an extended prophylaxis seems to help the high-risk population. So this would be research that would be extremely impactful on society. So thank you so much for your time. I'm sorry for my internet connection issues. And of course, I'm here to answer any questions you may have.